What tools are helpful to ensure safety of children and to evaluate children? How often should observations be happening?
Okay. Well, I think as a social worker, I've always wanted a tool to be able to give me an answer. But I've realised that tools don't give me an answer. And I think it's one of those questions that gets asked us a lot of, have you got a tool that can help us to do that? You know, and part of our answer is yes and no. Because really what we've got to do, first of all, is look at your context and your situation and what tools are going to be most helpful for you. And what we want to really do is look at, there are different situations and different parts of, for example, reunification work, of different tools that you need to have in place. So first of all is knowing the child. So we need to have tools and systems in place that work for you, work for your organisation, and work for your staff. They may have different levels of literacy that enables you to have information about your children.
What might that look like? A tool like, say, to know your child better, for example?
So if you've got a children's home or a foster care placement, we use the terminology of essential information, which is essentially knowing everything about that child that you are looking after, which replicates what a parent does. You know, so if I ask you, Mick, as a father to 2 children, you can answer questions about your 2 children.
And if I couldn't, my wife could.
And it's all up there.
Absolutely.
Yeah, it's all stored.
Nothing written down.
No. But when we are caring for children, we need to write that information down because carers change. You know, but more importantly, a child moves, and your children, who are now in their 40s, come to you and they might ask you questions about what happened in their childhood. You share stories. But for a child who was living in a children's home or a child that was living in foster care, they might not be able to do that. And they are then reliant on the information that they have. And they should be given information about their childhood. And that will be written down because they're not going to remember everything. Okay? So knowing our children is really, really important. But then we've also got to know the families. And that starts with doing an assessment. And it's about creating a tool that gathers the information that we need. You know, so we kind of say there's a tool that we often use that's like a triangle. Here is what the parent's capacity is, here is what the child's needs are, and here are the factors, the environmental factors that can influence and affect a parent's ability to provide for their children. And that can help us to gather information, but it doesn't tell us whether that family is safe or not safe. That takes another step, and that's about when we've identified needs, identifying then the risks, and then it's talking about can we put in protective factors to minimise those risks, and then we kind of get into an analysis of impact.
And that triangle might not be something that necessarily people would call the tool.
No.
It might not be what people are thinking of when they're asking for a tool, but it is, isn't it? It's that thing that helps you to do your job.
Yeah. And it's making it work for your organisation and your staff in your context. So we always say to, organisations will often come to us and ask us for a tool, and we say, well, the tool that we would help an organisation in Indonesia develop will look very different from one in Paraguay. Will look completely different from one we're doing.
And why might that be?
In Uganda. And that might be because of legislation. That might be because of the literacy skills of people. It might be about the role that your organisation has. They will vary, and we have to make it work for you. Because if it doesn't work, it's not going to be helpful, And we've also got to be conscious that we use the right tools for the right purpose, And I mean, you will have lots of experience of that in terms of psychology stuff, of tools there can be used in a slightly different way to how we would use tools in the social work environment. Do you want to?
Yeah, so I would often use tools in a very different context, but there's The tools that I would use require a certain level of training to use them, and they require a certain understanding of the context. So the question would always be, as Dan was saying, what is the purpose? What are you hoping that this tool will do? So for me as a psychologist, often would be trying to understand where a person is at now. So in terms of their mental health or their well-being, I'd be trying to get a picture of where are they now, so that then in future I could have something to start at that baseline and to see, have they moved forward, have they gone backwards, is what we're doing working essentially. But in order for me to use those tools and to be able to use them to analyse and to potentially make a diagnosis, which is not something that I do in my current position, but certainly have in the past, then I need to know that that tool that I'm using is valid. And there's lots of different types of validity, but particularly in this context, I would need to know that that tool is valid for the culture that I'm using it in, because very rarely have the tests that I trained in and used in Australia been validated for other populations. So many of the countries that we work in, I would not feel comfortable using that tool because I don't know that it's appropriate for that context. And I think far too often we take a tool trying with, again, good intentions, wanting to help get information, wanting it to be useful, but not understanding that it's not appropriate for that context.
And can I just add, so I think you raised a really good point there, which Caitlin almost tapped into as well at the same time, was about people can often think that a tool is going to give me an answer. So I go through the tool process which I've come across, and probably sometimes ignoring what you've just talked about. Is it appropriate? Is it contextual? Not necessarily well experienced in using it, maybe. And then out of that, we're looking for an answer. And you think, well, the tool itself is not going to give you an answer. It's going to give you some indicators that you're then going to have to process to be able to help you lead on balance, which is the best outcome that you're looking for.
Yeah. I mean, I kind of say it's a bit like having using a spade. The spade doesn't dig the hole for you. You've still got to put the work in, but it makes the life a little bit easier. And that's what a tool is there for. But one of the big things kind of in the sector is often we look for something that's free or available on the internet, but that might not be the best. And a big thing has been using things like the Child Status Index. Now that's a tool that works very well in community support work. But it doesn't work very well necessarily in child protection and in reunification work or assessment of foster carers, because that's not what it's designed for. Now, you can use it in those contexts, but it's not going to give you the richness of information that really you need, And so we need to be careful about what tool we use in what situation. And I think part of it is about understanding what we're trying to achieve and then making that work for your situation. And I think that's crucial, And for us, a lot of our work and a lot of our time is spent helping organizations get a tool that works for them and getting a system that works for them, But I think, in short form, in answer to that question, I would say you've got to have a tool that really works well on assessments, something similar to the triangle. You've got to have a tool that helps you in terms of analyzing information in terms of risk. You've got to have a system that means that for the children you are looking after, you have knowledge about them, that you know them, and that you know what their future plans are going to be. Now, we call that essential information and care plans. Some people will call them different things, that's fine. But it's about understanding that we need to have lots of different tools that give us information that helps us to make decisions, but the tool isn't going to make the decision for us.
And I think just one final point on that once you've got those tools, becoming really familiar with them, because one of the problems that we know is that particularly with tools that are tick box, where you've got a list of things and you're just going through and you've got to find the answers, does this apply, does this not apply, that if your tool does have an element of that, and we'd encourage you to try and avoid it if you can, but I know I sometimes have to work with those kinds of tools, that how you then present that to the person that you're working with and explain it and talk through, I might have to ask you some yes or no questions and it might feel a bit repetitive. This is why I'm doing it. Actually giving somebody information, giving them control, because we know from some research that often people, they feel uncomfortable when they have a tick box form kind of just read at them. They don't feel heard and they don't feel cared for. And really, if we're going in and we're conducting an assessment, we're trying to find out about a family, we want them to feel cared for and we want them to feel heard. So it's about then, once you've got the tools, really knowing it well so that you know how to use it and how to not just use it, but to present it to the people that you're using it with.
And I think that comes down to the training and the mentoring of staff.
Yeah.
It's about how to know what you need to be doing, you know, and a tool can't replace that. You know, you can't give someone a tool and then not train them and mentor them about how to use that and use that in the context it should be used in.
So much more we could say about that. I'm kind of, there's a number of things going around in my head here thinking, you could, and I'm conscious of time, so maybe we just leave it at that on that one, but there's so many other things we could do.
And just coming to the bit about, you know, how often should observations be happening? It's a bit of a really difficult one to answer because it depends in what context, in what situation.
What are you observing?
What are you observing?
Yeah.
But I think, again, you've got to be very clear about, once you know what that context is, so if it's foster care, you've just placed a child in foster care, it's about having a procedure. Now, if it's a first, you know, the child's just moved there, you want regular visits.
Because the risk is higher.
Yeah. But then in time, you make less visits. Again, in reunification, in the early time, you do more visits and then you reduce. But you might have situations where you need to keep visiting.
So that's what I was just going to say. You won't even get kind of like, this is the kind of a guideline of a suggested rate, but you may think we can go longer or we can go shorter, depending on what you find out. The clue is, are you doing the work that will give you the information to make that decision? And not just saying, well, that's the guideline, now I stop visiting because I don't have to visit anymore. Thinking, oh, no, you may well need to go longer.
And when you're doing assessments, it's again about the richness of what information you can. I will do some assessments and it'll take me 3 or 4 visits. And I've got the information. Others will take me 6, 7, 8, 9 visits. Again, it depends on the context.
I'm just conscious that for the person that asked that question, it might not feel very helpful. And I think that potentially with some of our answers, that's going to be the case because they're big questions and they deserve big answers and nuanced answers, and we don't necessarily have the capacity in a short time frame to do that. But I just want to acknowledge that because I know it's really frustrating when you ask a question and the answer is so involved or so vague that you don't kind of get out of it what you want. And so I'm apologising to the person who asked that if that's the case, but it is a really complex issue and there's a lot of different tools, a lot of different information, and we can't kind of address all of them in this context.
Here we are going on again, but I think it's typical really of a lot of people that we've come across in organisations wanting to do the best for children and really find out information. Can you lead me to the point? Can you lead me to the document? Can you lead me to the tool that'll help me do my work better? And we say, well, there isn't such a thing. You know, there are tools and there's documents and there's research, but depending on what you're doing, what your purpose, what your goal is, it's going to vary. On your culture, it's going to vary. And that's why it's actually quite difficult to say, here's a tool.
Because
here we go again.
I'll just say this final way. Because again, also it depends. You know, if you're in a country where there is a very significant legal procedure to follow, then what you need to obtain in terms of your information will be different to where you're not in a country with a significant legal process. All of those things make a difference. You know, the forms we're producing for an organisation in Western Uganda who are volunteers, you know, working with child-headed households with no training, looks very different to the form that we're developing in Indonesia. That looks very different to the form that we've developed, you know, with organisations in Paraguay with a very significant legal system. You know, it varies, but there are core principles that go through that.
That's the key.